Say
think mouth, think health. Hi everybody! Today is actually World Oral Health Day, and obviously we're getting involved with the message, say think mouth, think health. It's a really great message because there's a real odd disconnect around the world, but especially in Australia, that your oral health is isolated from your general health, which is very untrue.
Well, in Australia, Jasmine, Medicare covers general health for everyone, but it excludes dentistry. And that's led to some of the belief that they're separate. Mouth is separate to the rest of the body. It's just not true.
No. Your mouth is actually the start of your gastrointestinal tract. Think of it like a tube. It starts up here and it ends down there. Now it's all one interconnecting system, and whatever goes on the inside generally tells a bigger picture of your general health. Say you found blood in your urine or you've got blood in your stool. As a pharmacist, when I tell patients to look out for these symptoms of pink in your urine or black tarry stool, I always tell them to see the doctor straight away, just because it tells you something that's more sinister happening on the inside.
Yep.
Now, say you've got bleeding gums, or you've got tooth decay, or you've got a chronic infection in your tooth that your dentist has told you about, but say none of these are causing you any grief.
Yep.
Now, should we be really ignoring these symptoms, given the fact that this system is all interconnected?
No, well, Jasmine, you're right. You shouldn't be ignoring these symptoms. If you've got bleeding gums or toothache, yeah, of course it's a sign that there's something bigger that's going wrong in your body. Bleeding gums specifically is a sign of gingivitis or periodontitis. Gum disease. Gum disease has been linked to things like diabetes, heart disease, stroke and things, respiratory diseases like pneumonia, and in pregnant women, preterm babies. So you might think, okay, well great, these things aren't related to me. I'm not at risk of any of these things, no history of diabetes and whatever. Well, imagine though, that's what we know now. That's not the research that we'll find out in the future. I'm sure it's going to be linked to many other things. And we're also forgetting that tooth decay, it's a disease in itself. It's not something to be ignoring, and it is an indicator of your general health as well. So the message for World Oral Health Day of say think mouth, think health, it's a really great message.
Absolutely. In today's society, there's a huge emphasis on general health and well-being.
Yep.
We're all eating really healthily, we're all exercising, everyone's basically a member of the gym, some sort of a gym. We're doing our 5 serves of veggies, 2 serves of fruit. There's even a huge movement on superfoods.
Yep.
People talking about acai, chia seeds, kale. We're doing all these things because we want to be healthy.
Yep. There's even more people doing yoga and meditating, focusing more on mental health, which is obviously a big part of general health as well.
Basically, we're doing everything we can to make sure our general health and well-being is in tip-top shape. But why is it that we ignore our oral health when it's such an integral part of our whole general health?
So today and every day at Method Dental, we're challenging you to say think mouth, think health.